Today's podcast will briefly discuss when a pharmacist can choose not to dispense a medication, even if there's a valid doctor's order. In a recent case, a doctor sued the Iowa Board of Pharmacy and the Iowa Board of Medicine when a pharmacy failed to fill a prescription for Ivermectin, a livestock drug sometimes used to treat parasites in people, which can also allegedly be used to treat COVID-19. This incident highlighted a dilemma that's become all too familiar in the pharmacy world, particularly in the wake of the pandemic. While pharmacists have a long-standing role in ensuring the safety and appropriateness of medication therapy, the COVID-19 crisis and the debate surrounding drugs like Ivermectin have put a spotlight on the autonomy and clinical judgment of pharmacists. Many states require that pharmacists act independently and have a duty to independently determine the appropriateness of therapy in conjunction with a doctor. If a pharmacist acts as a mere conduit for a determination by a doctor, the role of the pharmacist is significantly limited, and this can have significant downstream ramifications extending into reimbursement, licensing, and/or job descriptions. Number 2, not dispensing birth control. Switching gears slightly, we look at another instance where personal beliefs intersect with professional duties. A story from USA Today exposed a scenario where a pharmacist refused to fill a prescription for birth control, citing faith as the reason. Unlike in the first case, where the pharmacist allegedly expressed reservations about the efficacy of the treatment, in this situation, the pharmacist expressed concerns about the safety and appropriateness of the proposed treatment, since it was an affront to the pharmacist's own personal feelings regarding abortion. Such actions, though personal, pose a significant question. To what extent can and should pharmacists exercise independent medical judgment? Governmental role. It's not just individual pharmacists facing this dilemma. The broader pharmacy sector is grappling with it too. A piece from 19th News reveals that some governmental authorities like the Department of Health and Human Services disagree with pharmacists withholding medications based on personal beliefs. They argue that this practice can lead to barriers to essential healthcare services such as birth control or emergency contraception. However, courts have not always sided with the political branches of government when it comes to determining whether pharmacists can adhere to their own personal determinations, and such cases are often determined on a state-by-state basis. As pharmacists, you're trusted to make sound decisions that prioritize patient care, but these instances put a strain on the traditional framework, urging a discussion on the delicate balance between professional discretion and adherence to medical guidelines. I don't have a solution for you, and these cases are making their way through the court system. But the conversation is important and complex, and it's one that needs to be had. It invites a deeper exploration into the ethics, the laws, and the evolving roles of pharmacists in our healthcare ecosystem. As we navigate through these murky waters, one thing is clear. The dialogue between pharmacists and the broader medical community is crucial in forging a path forward, and this serves the interests of all stakeholders, most importantly, the patients who rely on your expertise and care.
This is the DarshanTalks podcast.